Evening, everyone. Thank you for joining this session. Today's topic is ancient wisdom for modern life, and we have Dr. Prasad with us to give us brief briefs of the Ayurveda. I will quickly introduce Dr. Prasad with you all. Dr. Prasad is highly respected Ayurveda Ayurveda practitioner with over 26 years of clinical and industry experience. He holds an MD in Ayurveda and is the founder and director of One Ayurveda. Over to you, Dr. Prasad. Thank you.
Hi, good evening, everyone. I'm Dr. Prasad Vaidya, Director and Chief Physician of One Ayurveda. And on behalf of One Ayurveda, I welcome you all to this exciting webinar where the ancient science uh, will guide the path for the modern science or those who are working for modern science, modern professional, busy life professional. So in next 30 minutes, I'll be telling some facts and some interesting things, which will I'll ensure you that this will help you in your life to achieve health and wellness. So to begin with, next.
Suman, please.
Yes,
share
I'm
the
trying.
slide.
1 second.
So
Yeah.
first, I think we will pay homage to the those who are lost their valuable life in 22nd April, and we strongly condemn this cowardice attack on these innocent people, those who have died, and we pray for those who have injured for speedy recovery of them, and we condole the death of unfortunate innocent people, uh, and after paying them homage, we will start our regular work. Next, please.
Uh,
So next, yeah. So this is Lord Dhanvantari. I think if you see the face of Lord Dhanvantari, it is very much similar to Lord Vishnu. Only two things apart. One thing, I think he's carrying that Amrut Kumbha in his left hand, the elixir of life in a earthen pot, and in his right hand it is leech, or what we call as jadu in Ayurveda. So it is having so much of the leech application, or the jadu having such a important aspect in Ayurveda, that Lord Dhanvantari carries that leech in his hand. So that is something important. And I think we all consider ourselves professional, and we always there is, I think, increment time or there is bonus time now. Maybe in, I think, 2-3 months. Am I right, Suman? There will be increment time or bonus time now.
Yeah.
So we always consider.
Actually,
Yeah, so
yeah.
we
Uh,
always consider ourselves as a professional. But I'll
yes.
tell you a story about Dhanvantari, Lord Dhanvantari. So they are more professional than us. So when, I think, the ocean churning was going on, and that time the 14, the last jewel who came out of is the Lord Dhanvantari with the pot of nectar of life, or we can elixir of life. So when he comes out, and then he handed over that pot to Lord Vishnu, who was of course the boss, the MD of that complete organization, and he has asked him that, see, I have taken out this pot for you, and this is like elixir of life, and after having this, you will never die. So I have carried this for you. So will I get some part of this? Will I get that increment because I have got this for you? But Lord Vishnu, like any other boss, he said, "Ki, no, bhai, you are not the person still qualified for that, because the churning and everything is done by us, and you have just come up with the pot with elixir of life, so you are not qualified to get the bonus. So what you have to do, you have to take a birth again, and then you have to teach Ayurveda to the people there, and then you will be known there as a founder of Ayurveda. And once you have known about this, and then only you can come again, and then we will offer you the elixir of life." So that's kind of a hard work Lord Dhanvantari has to put to give us the knowledge of Ayurveda, and then only he can get the bonus. So the professionalism was there in the God, and I think we are following the same thing. Here I have given a small Dhanvantari Vandana, Namami Dhanvantari Madhyam. I'll just tell the gist of this, that it is the only god which has been prayed by Surasure, like demon and the god both. So now there are some boss of demon, there are some, except Brahma, Vishnu, Mahesh. There are some boss of demon, there are some boss of gods, but he is the only god who is basically acknowledged or prayed by both. And there is very peculiar thing in the second line, where it has been said that Jara, that is uh, yeah, Jara, uh, that is old age. Then Ruk, that is pain, so that is surgery. Bhaya, so that is mental disorders. And Mrutyu, that is death. So for all these, Dhanvantari has proposed some medicines. So that's why we pray to Lord Dhanvantari for this. So Dhanvantari contains all the surgery, the medicine, and the psychological disorders, aging, senility. So everything is covered by Lord Dhanvantari. So that's why if you go to any Ayurvedic clinic or rather any big hospital, you will see the statue of Lord Dhanvantari. Next, please. So with a standard disclaimer that whatever information I have shared here in medical, this is not a consultation, so you have to take your guidance of your doctor. The content which till date, whatever the content available that we have put, so medical contents are always updated, so that I think you can always check with your doctor. And the images and everything which are put, these are copyrighted images, so it is only for educational purpose I have put here. No commercial gain is involved in it. Next.
Sir, sorry to stop you in between.
Yeah.
Everyone, we will give you 15 minutes of time in the end. Whatever questions, queries you have, you can put it in the chat box and doctor will answer your queries. So I request all of you to please keep the questions in the end. Thank you.
Thank you. Thank you. Next, please. So now, first thing I think we will learn about basics of Ayurveda, and Ayurveda is called as science of life. So it is not just for the fun we call it as science of life. It is basically the science of life. So it starts from preconception. So you must be doubting what is that preconception. So there are now many patients. We are having almost 200 to 300 patients in our generation. Practically, I think you must be between 20 to 40. That's what I come to know from Vartika. So in our generation, there will be hardly one child, or at the most two child we will have, because we can't afford more than that. So that one child should be like the best one we should have. So for that, the sperm quality and the ovum quality should be the best. So the preconception panchakarma helps in cleaning, helps in providing the best quality of sperm and best quality of ovum. So we have almost 200 to 300 patients with us who have done this, maybe for their first child or for their second child. From someone they heard that this helps a lot. And I tell you that the offspring which they have produced is it's like something different only. Like they themselves say, he or she, whatever may be that offspring, is out of something, like he is extraordinary. So those who want to try maybe for their next generation, they can always opt for that preconception panchakarma, and that is really giving very good result. The another aspect of preconception panchakarma is now we are inheriting several diseases like diabetes, maybe blood pressure, maybe some rheumatoid arthritis, gout, or something sort of a thing. So many diseases are now inherited. So this is something. If preconception panchakarma, if the couple does, both husband and wife both, so that will help in minimizing this effect of this inheritance. We have not any study, because it takes almost 15, 20, 30, 40 years for that. So we don't have any study for that, but definitely this is kind of a best therapy. If mother and father both does the panchakarma before conception, that will help them a lot. So next is during conception. Now we have, I think, there is a very good concept in Ayurveda that every month there is some different organ which is developed. Like in fourth month, the heart is developed. Everything is going simultaneously, but the fourth month is specifically the heart is developed. Fifth month, the mind becomes more active. So in that case, in Ayurveda, there are medicines available for each and every month. If the mother takes, then it has tremendous effect on the child. and they are extremely safe because we are using in practice since last. I am using in practice since last 26 years, and I have not seen any side effects of that. Rather, as I said, the offspring which develop is like extraordinary. I have one case where mother and father both are simple clerks, and their child, after doing all this thing, he has got almost 90 plus marks in SSC. So I'm not saying only because of this, but definitely this all things must have helped him to achieve that. So we have pediatric, we have adult, we have gynecology, we have geriatric. So all aspects of our life has been covered by Ayurveda. So that's why it is called as science of life. Every stage of life is covered by Ayurveda. Next. So I think this is the basics of
Dr.
Ayurveda.
Prasad,
Huh?
before you begin, Rajat has mentioned that he is unable to hear. So can you keep the mic closer to the mouth?
Yeah, yeah. Is it
Thank you.
okay, Prajakta?
Yeah,
Sorry,
I think
Pavita.
much, this is much better. Thank you.
Yeah, fine. Sorry. So now we will learn the basics of Ayurveda, and I think I have put a story before this program that do you consider that belching as vata, or maybe the burning sensation in your stomach is pitta, and the mucus which you pass during the sneezing is kapha. So how many of you agree? Let's have a poll that how many. If you are agree with all these things, then say yes, and if you agree, if you are not agreeing with this, please say no. So uh, please raise a poll.
Is the poll visible to all? I have launched it. Yes, people are replying.
Shall we end the poll? I think almost. Still there are people replying. Yeah.
83% people have mentioned yes.
Very good. Very good. Nice. So I'll tell you in short what is Vat, Pitta, and Kapha, and then you will come to know the answer on its own. So see, if you, I'll give you example of tube light. So what you do when you light the tube light, you just on the switch, and there is a electricity flow from that part to the tube light, and the filament which is inside the tube light that gets illuminated, and you have the light. So how Vat Pitta Kapha is you can correlate with. So once you on the light, then there is a flow of electricity from one point to another point. So that is called as Vat. So whenever there is any movement in your body, like you are waving your hand, now you are pressing the thumb button. So any movement in your life is considered as Vat. So now I'm talking. So movement of my larynx, movement of lips, everything is Vat. So is there, if there is any movement, so it is considered as Vat. Now that electricity goes at the part which is dead, and then they change the color. So it changed the color, and from nothing it turns into white or yellow or blue, whatever maybe that filament is, and then it gives illumination. So it gives a light. So whenever there is a change in temperature, whenever there is a change in color, that is pitta, and the electricity is continuously flowing there. So there is a stability, there is a steadiness over there. It's not every time we have to press the button and start electricity. So it's a stability. Unless and until we turn it off, there is a steadiness, there is a stability. So that is called as kapha. I think it's little difficult. So let's have one more example. So when you are eating, suppose you have a plate of pav bhaji in front of you, and when you are eating the pav bhaji, the moment of mixing that pav bhaji and putting it to your mouth till it reaches the stomach, so that all movement is vata. Now when in stomach there are hydrochloric acid and some juices, some enzymes mixed with it and change that pav bhaji, is your blood color of pav bhaji? No, it's red only for everyone. Am I right? So the blood color changes because of the pitta. Whatever you eat, you made dal, you made vada pav, you made basundi, you made pav bhaji, whatever you want to eat, you can eat. But that turns into the color into the red. So that change in the color, that change in the temperature is done by pitta. And when it goes to your intestine, the best thing, the best juices are absorbed by your body to give you strength. So that is called as kapha. So am I clear? So I think one exercise we all do here is when I say one, two, three, just clap your hands 3 times. Okay. So shall we start? Yeah. So I'll say one, two, and three.
One request to all the participants, if they can switch on the cameras and the doctor can see you all doing the
Yeah.
activities and participating in it, it will be really great. Thank you.
So again we will start. Please switch on your cameras.
Suman, it's not possible for them to switch on the cameras.
Fine, no problem. So I'll start it
Everyone
again.
can everyone can mention their experience in chat box, and if there are
Or
some
just say
questions
thumb.
which
It's
are
fine.
added
It's
in
fine.
Q&A, we will be answering them later. Also, Sushila, yes, doctor will share some encouraging points. The ends of the session has been interactive, and we'll answer all the questions then. I hope everyone is comfortable with that. We don't want the session to be delayed for others.
Okay, so I think everyone has done this. So very good. So now tell me where the Vat, Pitta and Kapha is included in it. So let me answer it. When you clap, the movement of your hand is Vata. So when I told you to clap only 3 times, so you stopped after 3 times. So that is Kapha. And when you clap, have you noticed the change of color in on your palms? So that has become more red. So that is called as Pitta. So whenever and wherever there is a change of color or temperature, so somebody has acne, so what it contributes to? Pitta. Somebody is moving their hand, so that is called as Vata. And somebody is steady or maybe stable, so that is called as Kapha. So I think this is something which is very basic, because when we go further, I think you will yourself know that which dosha is involved, and that will be easy for you to understand what Ayurveda is. It's not only about the flatus, it's not only about the belching, it's not about the mucus which is coming out. Of course they are the part of Vat, Pitta, Kapha, but the main Vat, Pitta, Kapha is something which is different than these things which are generally considered about. Next, please. So now why this meeting is basically we are conducting. It's a Friday 4 p.m. 5 p.m. and it's a time to go home and watch Netflix rather than you all enthusiastic people. I think more than 97 people are there. They are having here to listen about Ayurveda. So why what is the interest in this? So let's have some details, some numbers. So is India growing? Yes, definitely. In 1995, I think we are on the 15th number. uh, I think we will answer it afterwards, Aniket. So in 1995, we are on the 15th number as far as economy is concerned, or 13th number on economy concerned, and now in 2025, we are on the fifth number. So slowly, I think maybe in 2045, we will be aiming to go by third number. So definitely India is growing. But what about the health? So global health rank in 2019 is 57. Now we are 66. The global health score was 46.5 out of 100. Now we are 42.8. Next, please. So let's see the uh, prevalence of disease, the blood pressure, which was in 1990 only 10, and it has grown, I think, 3.5% to 35. Same about diabetes, 3 times growth. Heart disease, almost 2.5 times growth. So are we improving or are we going down? See the younger onset, rising cases of people less than 40 years are alarming. So once we are growing as a economically, we are going down as a health. So that's why we have to have a good health to enjoy the fruit of economy. Otherwise, we will be lying on bed and not enjoying the fruit for which we have done so much of hard work. So that's why where Ayurveda can help you. Next, please. So this is also one thing which I want to put in front of you. So diabetes and pre-diabetes, if we are sitting 98 people here, so out of that 27 people, 3 out of 10 must be having diabetes or pre-diabetes. Blood pressure same. Thyroid almost 1.1 to 2 uh, people are there having thyroid disease. Fatty liver 6 out of 10. See, such a huge percentage of people having fatty liver. uh, then spine disorders, almost 7 out of 10. So out of the 100 people now we are attending, out of 101, 70 people are having some or other kind of spine disorders. Maybe cervical spine, maybe lumbar spine, but out of 100 people, 70 people are suffering from spine disorders. So we as a young economy, we consider ourselves as a backbone. And if the backbone is damaged, then what kind of future we have? So for that, we are conducting this session, and we are really thankful for you. So instead of going to movie and everything, you have taken your valuable time to know about your health. Next, please. So reasons we all know, we the best quality of water we have, the best quality of food we are getting, the great air we are uh, taking in our breathing. Uh, we are sleeping at 8, 9, 9 o'clock. There are so much of exercise we are doing. There is no stress, only fun in our work. So these are all things I think we all know that these are contributing to our problems. But I am not going to now give you any lecture about that. Okay, we should eat this, and we should eat this, because I think you must have been over bombarded by this in WhatsApp University and YouTube University. So I'll not going to give lecture on these aspects, but rather I'll be sharing some interesting aspect which is told by Acharya Charak, that there are 9 rules for having food, and which can be easily followed by each and every one of us. And if that we follow, then definitely we will get the best out of our food. Next, please. So the only thing what we can do is that back to basics. We have to go and we have to find out that, see, if you compare your grandmother or maybe grandfather, they are much more healthier than us. They lived at the age of 70, 80, and they were doing all home chorus. And at the age of 40, it will be difficult for us to match with them. So why? Because they are doing something which we are not doing. So that's why we want to go to back to basics and learn Ayurveda, or rather take the help of Ayurveda to find out where we are missing. Next. So a lot of importance is always given to protein, carbohydrate, fats, and if you go to any diet site, there is always that you are eating more fat, you are eating more carbohydrate and protein and everything. But the interesting fact is that who is going to digest that? So that is a digestive fire, and that is different for each and every individual. So that is something which we should care about. Of course, we have to care about the food, but something which is more important, that who is going to digest that, the digestive fire. So we have seen several among us, that those who are eating 4 chapatis thrice a day and they are thin as paper, and those who are eating maybe 1 or 2 chapatis twice a day, they are having obese or they are having some problem. So there is a metabolic problem which is actually responsible whether you are fat or whether you are obese, whether you are healthy, where you are non-healthy. So in Ayurveda, it is called as Agni or digestive fire, and to protect that Agni, we have to take care of our food. So as I told you that I am not going to lecture you on what you should eat and what not you should eat, because that will take a little longer time. But we will simplify it in a very 9 simple rules which Acharya Charak has given. So next, please. So these are 9 simple rules for food consumption. You can see their faces, they are having their lunch. There is good, delicious food in front of them, and all of them are very hungry and they want to eat the food and see the happiness in their faces. Next, please. Nine. Yeah. Next, please. So first tool is Ushna Mashniyat. So eat warm food. So whenever it is possible, take a freshly prepared warm food. Don't overheat it into microwave. You know that microwave is not good for everyone, for us, because it is indirect way of heating. So once or twice, maybe once you can heat, but reheating is strictly avoidable, because it will you will lose the texture, you will lose the taste, and you will lose the vital ingredient like vitamin C or whichever the fat soluble vitamins are there. So that all you will lose. So the first rule is Ushna Mashniyat, that is eat warm food. The second rule which you can see is Snigdha Mashniyat, so eat Ankta's food. Now I think everyone will raise their eyebrows that Nowadays there is so much debate going on whether you should eat fat, whether you should not eat fat. But surprisingly, Ayurveda advocates the use of ghee in our food, daily food, and that ghee should be home prepared food. So if you know about that how to prepare ghee at your home, it's best. Or if you don't know, please text us, so we will prepare a video for you, a simplified method to prepare ghee at home. So that will help you a lot. So what ghee does, ghee enhances the digestive fire, and most importantly it increases the complexion. So we are spending so much of amount of money on improving the complexion for outside. If you take ghee regularly, I think you will be having the best complexion without using any artificial makeups. So you can see there is one roti which is without ghee, and that is increasing your sugar by 60. And if you apply ghee, that will increase your sugar only by 30. So our ancestors, that's why they have claimed us, that they have directed us to put ghee on our roti. So those who are diabetic, they know the glycemic, what I mean by glycemic index. So I'm just simplifying it. So if you eat a simple khakra or simple roti without ghee, your sugar will be increased by 60. And if you uh, in the put a little bit of ghee, then it will be around 30. And if you put some pudina chutney into it, it will be almost 15. So making a simple carb into complex carb, this is the key of diet, and that's what is narrated in Ayurveda. But unfortunately, we did not follow it now. Next, third route is matra va tashniya. That is, you have to eat in a proper quantity. What is the 2-1-1 rule? That is, two parts of solid food one should take, one part of liquid one should take, and one part should lefty for digestion, for left empty for digestion, so that it will mix properly. Those who are doing, I think, coconut chutney, those ladies who are doing coconut chutney, they know how to mix the coconut and the other ingredients and water. So similarly, our stomach, if we consider 100%, then 50% should be only solid food, 25% should be liquid, and rest 25% should be kept empty, so that it can be well digested. The fourth is Jirne Ashniyat. Now this is something, the picture is itself tells the story. The person is back, please. See, the person who is having a variety of food in front of him, but his face is not interested in having this food because his previous digestion is not done. So he must have done something good thing in breakfast, and the breakfast is not yet digested. But still he has to eat the food because it's a lunch time. And after one or between 1 to 2 only you should have your food. After two you are not allowed to food. But unfortunately the breakfast is so heavy that he can't use that food. So similarly, the rule which has been very clearly said that only your first food is digested, then only you should go for the next meal. So depending upon what you eat in your breakfast, that makes you hungry in your lunchtime. So please make sure that you are eating good food, and whenever you are hungry, that time only you are eating. Next, uh, just once last slide, please. Last slide, please. Yeah. So the why it is very important is, I forgot to mention one thing. Like, I think almost when we have our patient, out of 100, 70 patients are suffering from constipation. So this is the key. If you take food without previous food is digested, then you will face constipation. If you take the food only after the first food is digested, it will clear the bowel movements, and you will never face constipation like problems. Next, please. So there are some food which is considered as opposite in quality, like milk and fruits, like milk and salt. I think those who are doing the those who are working in kitchen, they know that if you add a little bit salt in milk, what will happen. So if you add little bit of sour things into milk, what will happen. So these are the things which one should follow. So most important thing, like we are having strawberry milkshake. So strawberry milkshake is strictly no in Ayurveda. Similarly, we are eating, many of us have a habit of eating chapati and chai, or roti in chai. So if you are adding salt in roti and the chai is having milk, so that milk and salt combination can cause skin diseases. So we have several patients with leukoderma or skin diseases, where if we stop these things, there will be tremendous result after this. because they are taking so many medicines for years together, but they are not following this simple rule that you should avoid any salt and milk, or maybe any fruit and milk. If you avoid this, then there will be very good result in your skin diseases. So those who are suffering from any skin diseases, especially leukoderma, the white patches, they should keep an eye that they are not eating salt or non-veg or fruit with milk or milk products. uh, the sixth fruit is Ishtadesha Ishta Sarvopakaram. So I'll not read the Sanskrit, but I think you can see that this is the most common sight of, outside any office in the lunchtime. The person is standing and he is just having his food, and in a paper plate, and then he is having some all mixture of food. So this is something which is should be strictly avoided. You should have a proper place. You should sit down. You should have a proper utensil with you, which should be clean. Only sour foods specifically. So I'll answer this afterwards. So so he's standing. So this is not a proper way of eating. See, all of us, we are doing hard work for food. हम लोग खाने के लिए इतनी मेहनत करते हैं. So that khana should be in a proper way. Spend 10 times on your from your life. Sorry, spend 10 minutes from your life. Sit down, have a proper food, have a proper utensil, finish it in 10 minutes, and then go to work. So this is a simple thing which I want to communicate with you with this photograph. Next. So these two are very common. My local is at 9 o'clock, and I have to finish my food. I'm late already, so I am at 8:40, 8:45, and I have to finish my food. So the gentleman is eating everything in a so fast that the food cannot be digested. There is always a chance that this hurry can lead to the choke up of trachea, choke up the food into trachea, which is very serious disorder. So please don't do this. The same way, I think if we have a child, this is very common sight. If you give any sabji or something like this, and then they are eating this in a 1 hour or 2 hour they take to digest it. So we know that after maybe 15-20 minutes we lose the interest in the food, and once we lose the interest in food, then the digestion takes place. Digestion takes backseat. So please avoid all these things like eating food in a very hurry manner, or maybe in a very slow manner. So you should have enough time to drink, to eat the food, to taste the food, and to digest it. Next, please. This is very common sight in any lunch room between 1 to 2. Everyone is sitting, somebody is having their laptop in front of this, somebody is having paper, somebody is having mobile. Nowadays mobile is very common, so we see that juki juki si nazar in everywhere. So similar in lunch, any lunch room, this is very common sight. So this is something should be very strictly avoided. It has been very clearly said that when you want to have your food, there is no talking, no laughing, no laughing, and no distraction while eating, because you are eating something which is going to give you strength for throughout the day. So just please 10 minutes, spend 10 minutes of your life and concentrate on your food. That will give you best result. Next. So many of us have the notion that the food comes directly into our plate, but no, sorry. I have given a map that from farming to transportation, then processing, distribution. So it follows a long channel to your kitchen, and maybe my mother, my wife, my daughter, somebody is taking a very much effort to prepare that and give it to me. So the food which is front of me has done so much of is able to come in front of me only after so much of struggle it has gone through. So please take care of that food. It is not something that you have to take it lightly. Please enjoy that food completely. In Ayurveda it is said that the food should please the panchabhautik, your panchamahabhut. So I'll give you one example. I'll not be so complicated. So I think you must have eaten sizzler in hotel. So any sizzler which come in front of you, once thing that first thing that the fumes coming out of the sizzler, so that is your uh, eyes, they are getting that taste of food. Then you get that aroma of that sizzler. So your nose, the second mahabhut, which is getting that aroma of that sizzler. The voice which is coming out in that sizzler, that typical voice which is coming out of that sizzler. So that is the ear. So that is getting that that sense of that food. Then when you touch the sizzler, that hotness or that softness, so that conveys that the food is ready and you should eat. And once you put it in your mouth, your taste buds start getting that feel of your mouth. So this is something all your Panchamabhuta are enjoying the food. Let's take an example of tea. So once you prepare the tea, you know that it is the smell. The first is aroma, which is coming, that aroma of tea which is coming into your nose. The sight of tea boiling, that is second thing which is pleasing your eyes. Then the touch, the hotness, and the taste. So these all your Panchamahabhuta are actually taking the best of the food, and you have to please that Panchamahabhuta so that all Panchamahabhuta are happy and they will give you the best thing to your body, the strength, the mental strength, everything they will give to your body. So just take 10 minutes, enjoy all your Panchakarma food through all your Panchakarma, not only through your mouth. Let every Panchamahabhuta gets excited with your food and enjoy it. So this is the 9 rules, I think, which are very simple. I hope you will follow. So any food you will be able to digest, and that will help you in having strength. So our next slide is regarding water. So I think I have asked a in my introductory video. I have said that there is so much confusion about water. So let's now come one by one to each question. Now this is a famous portrait of Raj Kapoor in, I think, Jagte Raho. Am I right? So in Jagte Raho, he, I think, in the whole movie, I think he went here and there for search of water, and finally in the end, I think this is Nargis who is giving, gives him water. So this is the importance of water. So without food you can live for longer duration, but without water one cannot live for one moment. So that is something which is very important, I want to convey with this. So now we will find out some misconception, or maybe uh, some knowledge which you gain from WhatsApp or maybe through YouTube, which is right as per Ayurveda or wrong. Next slide please. So this is very common question to us, that shall I drink water in the morning? So it is called as Ushappan. So the time is very peculiar, 90 minutes before sunrise. So now the sunrise at 6:30. So 90 minutes that after, between 5 to 6:30 you can drink water. So we follow some gurus, and guru says ki you have to drink water early in the morning. So guru wakes up at 4:30 and he drinks water. But we are the disciples of that guru. We wake up at 8 o'clock and we drink water because guru says. So guru actually insisting on Ushappan, and our morning starts at 8 o'clock. So Ushappan is very clear, and the time before Usha, that is time before the sunrise, which is called as Ushappan. So if you take Ushappan, how much? 640 ml of water maximum you can eat. Not that 640 of ml water you have to take it. And if it is stored in overnight in a copper vessel, it is much better. But if you can put it in any vessel, preferably now we consider as a glass vessel, much better, and you can take that water in the morning. So that will help in weight loss, that will relieve the constipation, that will clean your body, that will improve metabolism. Those who want to lose weight, this is the best remedy. Those who are facing constipation, this is also the best remedy for them. But make sure that uh, you are drinking that at proper time. And most importantly, those who are having weak digestion, those who are underweight, those who are malnourished, please don't do this. So this is not good for you, because that will further uh, uh, disable your metabolism. Next please. So these are three very common questions, that when I should drink water: with food, without food, with food, before food, or after food. So if you drink you drink water before food, then your fire will be the digestive fire will reduce. So definitely then you will not be able to digest your food properly. So that will result in weight gain or obesity. So those who want to increase their weight, they can try this: drink food before water, so you will increase your weight. Those who want to maintain their weight and health, they should drink water in a sufficient quantity, like only small amount of water. I think again I'll give you the example of grated coconut chutney. So if you put more amount of water, it will become dal. If you put less amount of water, your mixer will be damaged. And if you eat proper amount of water, then the chutney will be very nice. So similarly, we have to sip small amount of water, that is also room temperature water, during our food, so that our food is warm, our food is moist, and that will be well digested in our stomach. If you drink water after meals, then again it will cause the same thing as I told you, that coconut chutney will damage and it will become you can't eat or you can't drink that coconut chutney. So similarly, if you drink water after food, immediately after food, then it will cause indigestion, and that will damage your uh, complete digestion, so that is not good for you. So when you should have water, okay, once after 1.5 year there will be a natural thirst, so that time you can have again water, because then when the food is in stomach, the hydrochloric acid is mixed and the temperature will rise, so that time body will require some water to cool it down, so body will ask you for water, and that time you can have it. Next please. So water at bedtime, there are many questions. Many people ask that we have a habit of drinking water at bedtime, maybe at milk at bedtime. So if you are 18 age and above, please try to avoid milk at bedtime or water at bedtime, because we have seen several cases in our practice successfully treated by just telling the patient to stop water at bedtime, specifically those who are having regular headaches, asthma, sinusitis, or maybe frozen shoulder, or maybe any joint pain, joint swelling, morning facial swelling. So just stop your water at bedtime and see the result. Don't take any medicine. Just stop your. Don't take any medicine. Of course, I am saying this. You have to consult your doctor, but don't take any specific medicine for that. But just stop your water at bedtime, and that will give you a very good result in your sneezing, in your headache, sinusitis result. And if you are really thirsty, then sip a very small quantity of warm water. One more thing, those who drink water at bedtime, they will have an increased urination frequency, so that will disturb the sleep. So next day you will be sleeping in the office. So that will again will not give you the promotion. So to get the promotion, don't drink water at bedtime. Next, please. So there is uh, always a debate: warm water or cold water. Yeah, both are important if you are having pitta. So now I think many of us can relate, where there is a vomiting, there is a fatigue, there is giddiness, thirst. So that all contributes to pitta. So there you can have cold water. Cold water is not refrigerated water. Cold water is something which you are kept in earthen pot or earthen matka, so that is cold water. And warm water is of course not the very hot water or warm water, but if you are having slow digestion, slow appetite, if you are having sinus problem, then you should consume warm water. Next. So how much water you should drink? I think there are several WhatsApp videos on this. Karina Kapoor says you should have 4 liters of water, that will cleanse your body. Some people say you should have 8 glasses of water in a day minimum. So that is see, specifically Ayurveda is very personalized. So somebody is eating 4 liters of water if they are thirsty, that is right. If somebody is eating only 6 or 8 glasses of water, depend upon their thirst, that is also right. So it is, there is no fixed amount that you should have 8 glasses, 10 glasses, 12 glasses of 4 liters, 1 liter, 2 liter. The simple signal is that whenever you are feeling thirsty, take water. So that is the simple solution which is given by Ayurveda. And focus on your body signals. Like if you are having urine dark color, dark brown color, dark yellow colors, and definitely you are having less amount of water, have a good amount of water. If you are having say rice color urine, or maybe very light urine, light yellow color, then you may be having little more water, so reduce your water consumption. And you are having urine with good yellow quality color, then you are having a proper amount of water. So those who are with poor digestion, as I told you, those who are having ascites, those who are having asthma, swelling in the body, colitis, they should preferably having a less. They should preferably have less amount of water. So backside, please. Backside, please. So they should have a less amount of water. So general rule is that don't drink complete glass of water. Have half glass of water regularly, in a small quantity but regularly, so that your body remains hydrated throughout the uh, time. So this is something I think we have tried to solve your all doubts about the water. Now next, as I promised, we will concentrate on the two diseases. One is a fatty liver, which I think, as I told you, almost 6 to 7 in 10 they have the fatty liver. And similarly we will also concentrate on the lumbar spondylosis. So next slide please. So if fatty liver, it is not something like having some very odd symptoms. These are the very common symptoms. If you are having bloating, pain in abdomen in the right quadrant, severe fatigue, unexpected weight loss, then you may be having fatty liver. So please, if you are having any of these symptoms and which is occurring again and again, then get yourself checked for fatty liver. Next. So if you are in red zone, if you are having these kind of a symptoms, and you are having diabetes, you are having blood pressure, you are having obesity, you are having some medicines for very long duration, specifically painkillers or corticosteroids, you are having rapid weight loss or weight gain, and you are having alcohol, or maybe you are a regular eater of burgers or fats, cheese, and there is no movement, you are only coming to office and going to office, that is your exercise, then you are in red zone. So please be careful. If you are having any mixture of this, get yourself checked for fatty liver. Next, please. So why I should unnecessarily check it? So is there seriousness? Next, please. Yeah. So why I should unnecessarily check this? So is there any seriousness behind fatty liver? So yes, definitely. I think uh, you all are from Mumbai, maximum. Yes. So you know that fourth seat syndrome in the second class. I think we all must have traveled in fourth seat. Uh, so
Prasad, not everyone is from Mumbai.
yeah. But just I think I'll tell you that in Bombay local, generally there is a space for third seat, and the fourth seat is considered as a advantage. Like if the third seat is full, then the fourth person will come, and they will tell them to push a little bit, and they will sit on the fourth seat. So that is what happened here in fatty liver. When there are three people are sitting, you have a healthy liver. When there the fourth person comes and they try to push you, that is fatty liver. Still it is okay. Now that person's relative comes and then there's maybe a kid that sits on your lap, then what will happen? You will be further congested. The first and second child comes and sits in front of you, maybe occupying the window. So now there will be argument, so then there will be heated exchange, and then will be fight, and maybe either you will be injured, either opposite person will be injured, or the seat where you are sitting that will be broken. So similar thing happens here in liver, fatty liver. So your healthy liver, three people are sitting enjoying the seat. Fatty liver, fourth person comes and they occupy the seat. So still it is fine. And when the fifth person, the sixth person comes, then there is no place, there is fighting goes on, and then there is a damage which shrunk the place. Like you are either you are broken, or maybe the sit where you are sitting, that is also broken. So there is no place now. So that has shrunk the place to sitting. That is called as liver cirrhosis. Your liver starts shrinking, and once your liver starts shrinking, then the window for liver cancer gets open. So if you do not pay homage to fatty liver, then it may progress into liver cancer, not immediately, but maybe after 10, 15, 20 years. So you have to be very careful about fatty liver. Just take uh, care of your fatty liver. So how to take care, I'll tell you. Next. So five things you should be avoid if you are in that danger red zone. Then you must avoid fried foods, the normal bhajiyas, samosas, pakoras. These are generally they have used vegetable oil, which is very dangerous to liver. So that you should be avoid red meat, fresh red meat, because this is very high in saturated fat. That should be avoided. Refined grains, maida specifically, all things maida is available everywhere, so that should be avoided. Excessive sugar, sugar is very dangerous for liver and diabetes both, so that should be avoided. And the last but not least is alcohol and tobacco. Alcohol literally kills liver. So if you are using this as a regular form, please avoid it. Otherwise, the future is not so bright. So what you should take it? Next, please. So Triphala is I think one of the beautiful formulation in Ayurveda. It contains three fruits, so that's why it is called three means three, and phala is fruit. So it's a combination of three foods. One is the Indian gooseberry or amla, which is very good for liver. Then second is haritaki or harda, which we called as myrobalan, Termelia chebula, which we called as. So that is basically cleansing. So that have a cleansing effect on your liver, on your gut, everywhere. And third is bibitaki. So that is also very good for intestine. So these three are unique combination, very good combination. So if you take of a good quality triphala in bedtime regularly, then your liver is very well protected. I'm tempted. It's 5:50, so I think I'll go little fast. Otherwise, I was about to share you one story about triphala. So the next is turmeric. One should definitely take turmeric into our food. Then guduchi, which is very available now. Sanchamani veti, and I think it is very famous in COVID times. Barley is a magical food which I think we are forgetting, and we are running again behind quinoa and other foreign things. So barley is something which you add into your food that will help in reduction of weight, reduction in fats in your liver. Coffee is also very good for reduction in fat in your liver, of course without sugar and without milk. So if you have a black coffee regularly, that will help you in a way, of course in a moderate quantity, not 3 4 times in a day, but that will also help you in cleansing the liver. Next please. So Ayurveda recommends Virechan and Basti. These are the Panchakarma. So I think we always clean our room daily. But there is one time in year, like Diwali or maybe New Year or maybe Christmas, we clean it thoroughly. Every inch of your room is clean, neat, and everything is done before Diwali or before Christmas or before New Year, wherever. So this is something which is called as Diwali moment. These are Panchakarma therapies, which actually cleans every nook and corner of your body. So if you do it once in a year, it's not very easy, I tell you. But once you do it once in a year, next year I think 90% patient comes ki, okay, we want to repeat it, and that has given tremendous results. Like those who are suffering from acidity or any other problems, if you do Virechan, then throughout the day you are having nothing, really nothing. So I think we should invest in these kind of a therapy once in a year. If you do it, then you will be free from all kind of a disorders, at least for 1 year, next 1 year, depend upon your food habits. Next. Shirodhara, this is basically very good for stress. Those who are having insomnia, late night sleep, or not proper sleep, Shirodhara is one of the best remedy for them. Churna Potli massage is very good for fat, specifically skin fat, or where the specifically in tummy and thighs we have a loads of fat. So in that area, the Churna Potli massage also helps a lot. Next. So now, please tell me, these are the 7 pictures I have put it. So please, I think, Bhartika madam, please carry a poll that which belongs to you. Which one is you feel that this is me?
Everyone, the poll is live. You can answer the question, whatever image describes you. Once everyone is done, can they mention yes so that we can know when to end the poll? Or just give us a thumbs up. Also, I have noticed some people have raised their hand if they have a question. They can answer them. Okay. I see some people have mentioned the poll only has 5 choices and the is 7. I can also create another poll for this one. Majority people
You
opted
can
for
have, you
2
can
and
mention
choice
if
3.
it is possible 2, 3, whatever maybe.
Yeah. Uh, I guess most of the people have multiple.
Yeah.
Would you want me to have Dr. Prasad?
No,
Would you want?
fine. I think I just want to congratulate all of you, those who have mentioned the choice. So they are all prone to lumbar spondylosis. So these all are things which you should not use in your. These are all strictly no in your professional setting. So that's what I want to convey. So those who are having these kind of a postures, so please avoid this kind of a posture. So that's what I want to tell you, that almost 51% people have these kind of a postures or maybe multiple of these postures. which is putting a lot of strain on your spine. हम लोग जनरली बोलते हैं कि जो यूथ है दीज आर ऑल बैकबोन ऑफ आवर कंट्री. सो आवर कंट्री इज गोइंग इनटू दैट fresh economic era where we will be number third economy. So our backbone is the youth, and if your backbone is damaged, what will happen? Next slide, please. Okay, you are conducting poll again. 675. No, I think nobody will answer because I have revealed the secret. Okay, so I think we will close it. So friends, please avoid these kind of a postures. So these are the 7 or 8. There are many postures, but I can't put it everything into the slide. So these are basic 7 things which we all do it. So please try to avoid these kind of a postures. And what problems it will cause? So if you have a low backache, then there is a catch while you getting up from sitting position. There is a pain which is going from back to your legs, and there is a transient numbness, transient which goes and comes. The numbness, the paraesthesia means there is a tingling sensation in your body, in your specifically in your specifically on your limbs. Then these are all symptoms of there is some damage which has been taken place in your low back, maybe on your spine, maybe your spinous muscles. So please be careful if you have any of these one symptom or maybe a group of symptoms. So please be careful. Next. So, so what you will have? So these are very three common confusion terms. Many people always say I have a spondylitis. Many people say spondylosis. So what is the correct term? So this is spondylosis is a degenerative disorder. Litis is an inflammation, and listhesis is everything gone. One vertebra slips on other. So I can explain you in a very simple fashion. You have not done something, your boss fires you, so that is spondylosis. You start argument with him every day, and there is a continuous argument going on maybe every other day, so that is litis. And either your boss quits or you quit, that is called as listhesis. So I think it is very simple. There is a degenerative disorder. So when there is a wear and tear, so that is losis. So most of we are using spondylitis. So spondylitis is very rare. So don't use this term. You are referring to spondylosis. This is a wear and tear. Spondylitis is ankylosing spondylitis is very difficult disease. So spondylitis is something where everyday argument is going on. You are also shouting. Your boss is also shouting. So there is a lot of heat is generated. Why the heat is generated? Because of pitta. Am I right? There is change in color and temperature, which we said. So spondylitis is associated with pitta. Spondylolisthesis, there is a slipping of one ever, there is a lot of jerk, there is some fighting which is going on. So it's broke. So that then it is listhesis. So I think these terms are very clear. Next, please. So this is the correct sitting posture. I think this is very commonly available on net, so you can just see it. Your eyes should be in the same level of whatever you are seeing, like mobile, maybe your uh, laptop, maybe your desktop. So it should be in the same plane of your eyes. Second important thing which I want to show is that the area where we generally put our belt, the lower back area, so that should be always supported with something. If you have using this kind of a chair, please use some backrest or maybe even pillow is also okay. So put a pillow so that the area which is called as a belt area, that should be always supported with something. Whenever you are doing any work for a longer duration, please support that area because that is a main area where your body is divided and all your body's pressure is going on that area. The third picture which shows that don't use your mobile by tilting your head, neck, and everything. Uh, there is a very clear saying that if your head weighs 4 kg and if you bend your head on your neck downwards, then your head weighs 52 kgs. That is 13 times more than what it is. So please be careful. I think when any patient comes with the uh, kid that he want to become a doctor and which doctor field is good, we always recommend go for orthopedic because every one of us is using mobile every day by tilting our head down. So the best, we are all going to develop some kind of a spondylosis. So this is the thing which Ayurveda recommends. Google, uh, very common, very nice remedy. Gum acacia, I think dink, what we called is, and I think most of the ladies they know dink, because they must have taken the dink ka laddu in their pregnancy, sorry, post pregnancy time. Previous, please. Then methi fenugreek is very common. Nirgundi for application and for medicine also, and ashwagandha strengthening the muscles. So this is all commonly used in Ayurveda. Please consult your Ayurvedic doctor, and he will recommend you the best thing which suits you. Next, please. So these are some therapies which is suggested in spine dhara. One of the best therapy, those who are having little discomfort on the spine area, continuous stream of dhara is going on with medicines, and that gives a very good result. Abhyanga, complete whole body massage, actually improves your circulation, relaxes your muscles, with fomentation. Of course, not only massage, the fomentation is also important. Next, please. So Katibasti, we have several patients who are going here and there. They have done all the physiotherapy and everything, but Katibasti gives excellent result. So we always tell to go for Katibasti and then go for physiotherapy. That helps tremendously. That reduces the cost of therapy tremendously. Agni Karma, Manyabasti, these are some few procedures. Shalishashtik, when your muscles are totally weak, then this kind of a massage which is done, it's a specialized massage which is done by only experts. So this is something which is done in our Ayurveda, one Ayurveda clinic. So this is also very much helpful in strengthening your muscles. Patrapotli, very common massage, and which immediately reduces the spasm, which immediately reduces the pain. So these are all. Next, please. Next, please. So these are all commonly used therapies in our clinic, and we always practice this to give a instant relief and also a continuous relief. So as the Dhanvantari Stavan was the first thing, and the last thing is, we hope that everyone follows it, and sarve bhavantu sukhina. Everyone should be happy. Sarve santu niramaya. There should not be any person with any disease. Sarve bhadrani pashyantu. Sabka kalyan ho. Everyone should get whatever they want, and ma kaschit dukkham apnuyat. So that is, nobody should suffer from any kind of a pain, agony, maybe it a mental or physical. So that's what we pray to uh, uh, God, Dhanvantari, and I conclude my lecture. And I am really thankful to all.
Dr.
Uh,
Prasad, we can now answer
yeah,
the questions
yeah,
everyone
yeah.
has been
Please,
waiting
please.
patiently.
Yeah,
So first, I'll be asking you the questions shared on the Q&A.
yeah, please.
First question is, can difficult to cure diseases like tinnitus be cured by Ayurveda's help? Are there any special medicines besides oil to put in ear for that?
See, tinnitus is basically a disease of ear, where your inner the bones which are here, so that is causing a problem. So that can be because of constant sinusitis also. That can be because of degenerative also. So depend upon the cause. I will be able to tell you. Mostly, many patients are having suffering from sinusitis, and they have a secondary symptom as a tinnitus. So we treat sinusitis with medicines and panchakarma, and that results into very good the reduction of voice in the ear. So it depends upon why the tinnitus has occurred. So in most of the cases, it is sinusitis, so it will be treated very nicely.
Second question is, how much quantity would you suggest? I think this is regarding water.
I think I have answered that, in that there is no fixed quantity one should have. Whenever you are thirsty, you should take it. Now is the summer season, you can have 3 liters also. In the winter season, you can have 2 liters. If you are sitting in a, but as I said, you just check your urine, and that will give you enough indication that your water quantity is sufficient or not.
Uh,
Okay. I
next,
will read out the third question.
yeah, thank
For
you.
someone with gut issues, is raw vegetable salad harmful?
Yes, as per Ayurveda, we never recommend any raw vegetable salad, because it is very, very tough to digest. So it is always, you have to cook it properly. You have to saute it, and you have to add some ingredients so that it can be digested very well. But if your gut is disturbed, then definitely you should not put something which is very difficult to digest. You should put something very light to digest. So in Ayurveda, there is called a Sansarjan Krama. So after Virechan and Vaman, we have a specific diet plan for those who have done the Virichan Maman, and we generally put our patient having problem with gut issues onto that diet, so that helps a lot.
Okay. Who authored this shloka? I guess, sir, there was one shloka in the presentation. Would you like to just elaborate on that?
Which shloka you are saying?
Uh, on the first page, I guess, where Lord Dhanvantari's.
This is Dhanvantari Stavan, I think. Uh,
Okay.
I, which I think we commonly practice. I'll tell you because I also don't know. We always narrate this shloka, but I'll let you know. I'm
Okay.
sorry, really sorry. I don't recollect now who was.
Anyone who had that question can reply to the feedback email and we'll get back to you.
Yes. Uh, for someone with fatty liver, how to consume triphala?
Triphala ideally should be taken 1 teaspoon at bedtime with warm water. Either you can mix it in water or you can take triphala and consume water afterwards. But generally, triphala gets stuck into the mouth, so it is always preferred that you put it into water, mix it thoroughly, and then take it at bedtime. But of course, it's depend upon your sensitivity of gut because many times triphala can cause a little bit loose motion. So you have to adjust your dose. It's best that if you could ask your Ayurvedic doctor that which dose you should take.
Okay. Okay. How to cure typhoid using Ayurveda treatment?
Again, I said that I mentioned that though it is a typhoid, it is a Ayurveda always take a personalized approach. So even though you have a typhoid, if you have a fever, then the treatment changes. If post fever, the fever goes down and still you have typhoid, the problem with typhoid, then also the treatment changes. So it is typically depend upon person to person. But then we have several medicines for that for typhoid, like Sanjeevani Guti, which we use very commonly. Uh, then there is a Lagu Suchekar, which is very commonly used. So actually, we always any person and any disease when it comes in front of you, we use that Tridosha theory. We find out which stage it is. If there is a lot of fever, very high grade fever and everything, then there is a pitta dosha is increased. So we treat pitta first. So it's
Okay.
depend upon person and dosha wise.
Okay. Do Ayurveda have any medicine for autism in kids? My niece is moderate autistic and going through therapy like OT and BT.
Yeah, we
This
have
is
several patients now with autistic kids, and there are several doctors who are specialized, especially working on the autism in Ayurveda. So yes, we have. We have now several few doctors, young doctors who are working on autism in Ayurveda and with a very successful rate.
Anuradha, you can connect with the doctor and for more information on this. Okay, next question is sugar better than jaggery? Can we use jaggery instead of sugar?
See, as far as blood sugar is concerned, jaggery sugar or anything which is same, there is no difference in blood sugar. But of course, jaggery is a little rich in iron, so that helps in because sugar is useless. It only increases your blood sugar. There is nothing into the sugar. Of course, you can get the advantage of that glucose that you feel fresh and energetic, but otherwise it is useless. But jaggery is definitely good in iron, good in nutrition, other parts also. So jaggery, as far as the blood sugar contents, both are same. If you want to take advantage of any additional thing instead of sugar, then you can always use jaggery.
Okay. Next question is from Jaspreet Singh. Can you tell us the diet that would contain all the essential nutrients for our body in our daily life?
See, basically Ayurveda, as I said, we don't recognize carbohydrate, protein, and everything. Of course, these are the points. But in Ayurveda, there is one concept which is called a Shadrasatmaka. So all six tastes should be in your food. So that should be a best thing. The second rule is that you should start your food with sweet. So first you have to consume the sweet and then you should go on. So there are, as I again mentioned, that Ayurveda is very personalized disease. So unless and until we check your pulse, which dosha you are in dominant, so we can't just recommend any diet. But yeah, we are mentioning this to many of our people who are after checking the nadi in our clinic. Uh, there is a personalized diet is always recommended to them, and on their feedback, then we change here and there. So it can be very easily done if you visit any of our clinic.
Okay. Sir, there is one more question. By reducing the body weight, is it possible to reduce fatty liver?
Yes, why not? That is, in fact, the first thing you should do.
Okay. What should be the approach to cure the issues like rheumatoid arthritis and severe pain in the knee?
See, first thing is that there is a severe pain. So first approach is to reduce the pain. So we use dhara, we use agni karma, we use vidya karma. There are many therapies. So first, I think first and foremost, because in rheumatoid arthritis there is a severe pain, very horrible pain. So first thing, I think we have to reduce the pain. Uh, then we assess the dosha, which dosha is playing the spoil sort, and then accordingly we, whether it is ama, whether it is not ama, so accordingly then we use therapies, we use several medicines for that. Of course, diet is the very important thing. You should avoid sour salty things, that is the key. uh, if you follow this, I think we have several patients who are not on any medications of rheumatoid disease. Previously they used to on very steroids and several other medicine, but now they are free of all medicine. They are not using Ayurvedic medicines either. So whenever they have attack, they know what to do and they just do it, and they come to us, okay, I have attack, can I do this? And we do it, and then they are free. They know why this attack has happened. Because they are educated that okay, this you have to do, then the attack will come, so they are aware of that. So they know why the problem is occurred, and they try to solve it on their own with the help of us.
Okay. I will take one last question, sir, and
Yeah, excuse
then
me, sir, Dr. Prasad, sir, there are many questions.
Yeah,
So if you can spare 10 minutes, because then people feel that their
no
question was not
problem, I can
answered.
spare 10 minutes.
If everyone else whose question has not been answered or they want to wait, we are doing this for you. Uh, if anyone else who wants to leave, we understand you can go. Suman, if you would want to take a pause, it's okay. I know you will also have to leave. I will take this forward because otherwise, we do get people complaining that their question was not
no, no,
being.
I'm completely okay with it. I can read it, no problem.
Thank you so much, Dr. Prasad, sir, for your valuable
No
time.
problem.
Suman, you can ask
Uh,
questions.
yes. The next question is from Mr. Syed Aslam. Right side hip pain after standing for long time and numbness and tingling in both legs. Is it neurological or due to diabetic history? And do
See, if
we
it is
have any
radiating from
medicines
hip
for this
to,
in Ayurveda?
if it is radiating from hip to leg, it is mostly neurological. If you are having only tingling sensation at one part of your body, maybe your lower legs or the toes, only one part or only one area, then mostly it is diabetic. So it's depend upon the area of tingling, area of pain, and when it comes, when you change the position, are you okay? When you change the position, it gets aggravated. So generally it is a neurologic. If it doesn't aggravate or reduce by changing any position and it remains there continuously throughout the day, then mostly it is diabetic.
Okay. This question is very relatable to all the women's. The first day of period is very painful. What can be done for it in Ayurveda?
See, mostly the pain is because of the uterus muscle is very weak. The menstruation is like you have to throw out the blood, which is inside, outside, to the from uterus to outside. So the uterus gets contracted, and if the uterus is strong enough, then it can, the pain is very minimal. If the uterus is weak, then it has to get support of other pelvic muscles to push the blood outside. So that causes tremendous pain. So the first thing what we do in these cases is that you have to strengthen the muscle of uterus. So there are several medicines are available. One of the common most known is Ashoka Rishta. So that actually helps to strengthen the uterus muscles. So if you take it regularly, I'm just telling the name, but of course you have to find out why it has happened. Like in many cases there is a fibroid inside, so that is causing a lot of pain. In many cases the endometrium is little bit more bulky, so that is causing loss of pain. So basically it's depend upon the cause, but most commonly the we have found is that the lady is thin and the uterus muscles are so weak that they can't throw away everything. So they have to take muscle of pelvic muscles, and then it causes the pain. So in many cases, if you just strengthen the muscle, pelvic muscles or mainly uterus muscle, the pain gets reduced very easily, and they never get the pain afterwards.
Sir, how to treat pitta?
Uh, Very tough question. Uh, but basically, see, pitta is, I think you all know pitta is warm, pitta is hot. So you have to use the exactly opposite therapy. So you have to use the cold things. So maybe it cold, not in the cold temperature, but in the cold form of its property. Like the best cold thing I think you know is uh, dhania. Dhania is very cold. So you can now, nowadays, now there is a lot of pitta, there is a lot of heat, there is a lot of burning. So if you simply take dhania water, dhania jeera water in the morning or throughout the day, then I think that solves many of the problem. We always recommend our patient how to prepare dhania jeera water, and they take it, and many of the times only that dhania jeera water solves 90% of their problems. So it's, sometimes it is very easy, but sometimes it is very tough, because pitta also has some different properties. So depend upon that we have to use the medicine. But if you are considering pitta in now summer holiday, so I think dhania jeera water is the best thing which you can take. Sabja is also something which you can take regularly. Black kishmish or black grapes, manuka, what we call commonly. So that also helps a lot in reducing the pitta. Um, so the second therapy what we use is that pitta always comes in the, like, I have to go out from one door, and I am going, instead of exit door, I am going from the entry door. So there will be a lot of collision. So I have to take that pitta and throw it out from the exit door. So many times the small viration or something like that helps a lot to reduce the pitta. So it's depend upon person to person, but in general idea is very, if you are hot, then I have to put something cold so that I can balance that.
Okay. Sir, there is one question from P. Sarita. Can you please give explanation of Madhunashini for pre-diabetic person?
Madhunashini, what we are referring to, like Madhunashini is a herb also there, and Madhunashini is a tablet also. So if
So,
you
Sarita, we would require more detailed details on this question. I'll move to the next question. How to increase your metabolism?
see, it's very easy and very complicated also. Very easy is like why your metabolism is not working, that you have to find out. Either you are doing less exercise, either you are not eating properly, or either you are not sleeping properly. So you have to find out the cause, where are you are, either you are the six cause which I have written there. Either you are having a lot of stress, and that is causing disturb in your metabolism. So once you find the cause, you have to rule out that cause. That is very easy and very tough also, because sometimes your metabolism plays a very tough role. So then you have to do something extra, like you have to take some medicine, you have to go for virechan, you have to go for panchakarma, so you have to go for some extra exercise. So that way you can just boost your metabolism. Warm water is something which is a very cheap and common remedy to boost your metabolism. Warm water really helps a lot in increasing your metabolism. So triphala is also something which is very good in improving the metabolism. So you can try triphala also. But as I said, these all medicines, please consult your Ayurvedic doctor before using it, because these are not general medicine. These are very personalized medicine. So these medicines can be used to boost your uh, metabolism.
Okay. Next question is from Narendra. Banyan in finger can be cured by Ayurveda in age of 60.
Onion finger can be cured, but as I said, it is only it's again personalized, that we have to see the extent and everything, and then we can answer it. But it is possible.
How to reverse pre-diabetes by Ayurveda?
See, pre-diabetes is, again, we don't consider anything as a pre-diabetes or post-diabetes. We consider it is as a sthaulya, or rather obesity, what we call in a simple term. So the only thing is that your fat is indigested. So you have to digest your fat. Either you can reduce the intake of fat, or either you digest it by increasing your exercise or activity. Second thing, what we mention in the fatty liver, the barley, which is actually a very magical thing. You start using barley, mix it with your food. Stop using gehu or maybe wheat. So, or mixed it with barley. So that will also help a lot. So if you reduce your weight, reduce your fat, then definitely you are away from the diabetes.
Also, sir, just combining other question which was in chat box related to diabetes. Is wheat bad for diabetic patients due to gluten or any other reason?
See, wheat is something which is not produced everywhere. Wheat is generally now produced in Punjab and that area, so where the temperature is cold and their digestive capacity is huge. So if you go to Punjab, and you can't take that lassi complete. We need 4 to 5 persons to share that lassi. So similarly, that wheat is very heavy to digest in, as but wheat also gives you a strength, but wheat is very heavy to digest. So uh, basically those who are having less digestive power or less metabolism, whether gluten or not, they should avoid wheat. And if you have a very good digestive power, you are doing exercise, everything best, you can use wheat, no issue.
Okay. Uh, can Ayurvedic practices help with long-term issues like stress, fatigue, or hormonal imbalance?
Basically it is now common, till now I think before COVID it is common thing that long term Ayurveda is only useful in long term diseases. But after COVID I think the scenario changed, and many people with short term, like maybe diarrhea, fever also, they are using Ayurveda. But definitely it is very useful in long term issues, because it has a several other therapies to use, like Shirodhara, Shirobasti. There are several other therapies modalities we can use. So definitely it is very useful in long-term diseases. But of course, as I told you, the problem is that the person with having long-term diseases, they have used so many things, so they must have already damaged their body. So to come to Ayurveda and expecting result within say 1 week or 2 weeks, it's really tough, because we have to treat your disease, we have to reverse the damage what must have taken place because of you have used so many other medicines. So it's a little bit tricky situation for Ayurvedic doctor. So it will take some time, have patience, and you will get the best result.
Okay. Uh, Sir, again, I'm going back to the question about the Madhusudani. It is Madhusani in form of tablet.
See, I can't comment about any one tablet or whether it's a proprietary formulation.
Okay.
So it is very difficult for me to comment on one
So there
tablet
was
as a
another
specific.
question in chat
Okay.
box related to Ayurvedic medicines, like how to take them. Is there a way to take Ayurvedic medicine?
Yeah, there are I think 9 different time slots which has been recommended by Ayurveda. Like some medicine you have to take before food, some medicine you have to take after food, some medicines you have to take with specific, like some medicine you have to take with lime water, some medicine you have to take with warm water. So there are 9 different time slots which has been defined in Ayurveda as per your dosha involvement. So any Ayurvedic doctor generally guides you about this. So when the medicine should be taken, like some medicine, there is a very common misconception that all laxative should be taken at bedtime, but in Ayurveda it is said that all laxative should be taken before the dinner, so that will help a little bit more faster. So there are different time slots which has been given in Ayurveda, and you are depend upon which medicines and which dosha is involved, your doctor can help you.
Okay. Sir, next question. I will go to the next question. How to increase vitamin D and iron absorption in women? Because this is mostly every woman
See, as
is
I said, you ki vitamin D, and we are more focusing on vitamin D and iron, everything. If your
yes.
metabolism is very good, like just take example of your grandmother.
Yeah.
So, have you checked their vitamin D? Have you checked their iron? No,
No.
but they are working much more better way than us. So
Yes.
it's depend upon your metabolism. It depend upon your digestion, that uh, which vitamin we know only 10, 15, 20 vitamins, but there may be almost 50 vitamins which still exist. So if your metabolism is perfect, your digestion is perfect, forget about vitamin D. Yeah, if you have any problem like you have heavy menses and you are losing good amount of iron, then you have to replace it with your iron. So there are other ways of replacing iron also as per Ayurveda. But as far as vitamin D is concerned, uh, I think if your metabolism is perfect, because we have several patients who are never gone outside and their vitamin D is perfect, and the person who is always roaming outside in heat, their vitamin D is down. So it's depend upon your gut flora, your gut microflora, and there are several other issues which will help you to do this.
Okay. Sir, as earlier you mentioned that wheat is little bit heavy on for digestion. So if we change wheat to rice, then will it be good
See,
dietary
rice is
food?
also very good, but problem is that the cooking. We are using pressure cooker nowadays to prepare rice,
Yes.
so that is not good. If you use the traditional preparation, traditional way of making the rice, like removing the water, the starch content, then
Yes.
rice is also good. Though three things we always suggest to our patient regarding rice. First thing, use the rice which is old, at least 2 years old. Then use the rice which is not having aroma. Then don't use basmati, don't use ambemor, use which is having no aroma. And third thing is prepare your rice in not in cooker, but in the open gas.
Open vessel.
Yeah, open vessel.
Okay. Uh, sir, instead of jaggery, can someone use dhage wali mishri or thread sugar?
Mishri is very good, as I said, but then again, as far as blood sugar is concerned, these are all same. But if you compare to sugar property wise, then Misri is much better. Jaggery is also much better. But
Okay.
jaggery sometimes cause little elevation in pitta, so you have to be careful about which doshas you are in dominant in. So that way, like in pitta, we use dhage wali mishri. If in kapha we use jaggery.
Okay. Sir, these days in young people, it's a very common problem that every young people are feeling body contractions, knee pain. So what is the solution or you would like to suggest?
See, basically, as I told you, the basic is your digestion and exercise. In
Okay.
young generation, normally the sleep time is 2 o'clock. Then most probably they are indulged in mobile or continuous use of laptops.
Yes.
So if you're and they are continuously sitting, there is no exercise. Previously, when I think we used to go to any ground, the ground is always full of every. There is no place remain to play. Now the person are standing outside and they are playing on their mobile. So I think that should be avoided. If you really exercise, do well, play, enjoy your food, and relax. These are the three things key of your health.
Okay. Vartika, is it okay if we actually we have already taken too
Yeah,
much time,
we have
Dr.
uh,
Prasad?
we have to
I'm
go.
No,
so sorry
no
for the
problem.
question which we couldn't answer. You can just email all your questions to us and we will take the required answers
And
from Dr.
also, we
Prasad.
have shared one Ayurved's contact number, social uh, media links, and
Yes.
also shared the offer which they are giving us. So Sheila has mentioned you did not answer what question. So Sheila, I think your question was related to how to take Ayurvedic medicines, which has been answered.
Yes.
Yeah, I have answered this. I think there are 9 times of
And we have
different.
got okay. So Sheila want to know about her daughter. She wants to practice Ayurveda. And that's one question related. Like she wants to practice
So
Ayurveda.
now there are very good days for Ayurveda, and people are coming back to Ayurveda. So definitely she can pursue Ayurveda. Uh, it's very good science, and now it's gaining
She's
back to its glory.
12-year-old, and if you can give encouraging points on about future of Ayurvedic practitioner.
See,
She is
there are
attending this event. Her daughter is attending this event.
Yeah, see, there are now so many options for Ayurveda. Like you can practice, you can, uh, and it's a specialized practice that once you start Ayurveda, you are always a specialized practice. So once is a practice. Now there are several pharma companies they preparing Ayurveda, so they want people from Ayurveda to join them so that new formulations can be prepared. The R&D is now also booming up. So now out of India also there are so many queries generated for Ayurveda. They are also very enthusiastic. So if you learn Ayurveda, there is a very good future for you. But only thing you have to learn it from basic and 100% with your mind and body into it. So that will give you a very good future for the. And basically, it's good for you yourself because once you know the secret of healthiness, you can yourself try those on you first and your family second. So you all will become healthy. So that is the best advantage you can have.
Also, just we are taking the last question because there are 4, 5 questions related to typhoid. Uh, how to cure, and if like it's common to have body pain and
Yeah, it's very common to have body
especially
pain.
lower back, stomach, and hips during typhoid.
Yeah, it is very common to have body pain during typhoid because of the intestine problem, the absorption of good thing which is not happening in the typhoid. So because it's the bacteria, basically typhoid bacteria is in the intestine, so that is causing the swelling in the intestinal lining, and that's why the good things are not absorbed. So you feel fatigue, body pain, and everything. So in that purpose, as I told you, we always give some medicine like Rasayan Vati, and there are many other medicines which are available. First, to improve the circulation. Second thing, to the most important thing in Ayurveda is Rasayan and Vajikaran therapy. So that helps in nullifying the toxins which has been produced by the uh, bacteria. number one. And second, strengthens the body, strengthens your flora. And if your flora is strengthened, then definitely the food will be absorbed, the digestive juice will be absorbed, and you will having a less pain and everything. So we have very good medicines, and we are treating it regularly in our clinic. Sometimes we are treating with antibiotics, sometimes we are treating without antibiotic also. So with antibiotic also, sometimes Ayurvedic medicine works a lot, works very best.
Thank you everyone for the question. There were some people who were asking questions beyond the 6 o'clock time as well, adding to the questions. We will not be able to answer, but I have shared social media links of Ayurved One. If you will go through them, you will understand most of the questions are also answered in their bite-sized informative videos like graying hair, knee pain, when to take, what to take. They always keep answering these things. And you have also a free consultation with them as per this webinar, which for which the form has been shared. So you can take free Nadi prediction and 15% off on all Panchkarma treatments. This is valid for both offline and in-person consultation. The form has been shared to you in this chat box and it will also be shared in the feedback email. You all can take consultation there as well. A form link I have shared above, I can share again. And this will be part of feedback email as well. So if in case someone misses it, it's totally fine. We will also be uploading this webinar as in our YouTube channel in similar to all the webinars which are uploaded there. I have shared the form link again. Thank you so much. Suman,
Okay.
we can conclude. We
Yeah.
have already been.
Thanks a lot, Dr. Prasad, for very interactive and very informative session. I guess we couldn't answer most of the questions. We actually tried answering most of the questions, but some of them
We have
we could
actually answered 50
because
questions, so it's
yes,
really difficult.
we
Uh,
also have the time limit. Yes.
No problem, and thanks a lot, Vatika. In spite of your health, you just presence, and Suman, thanks a lot for the hard work you have kept it.
Thanks a lot, sir. Thank you. Thank you so much.
and
Thank you
Thank
so
you,
much,
and
everybody,
Anyone
for
who needs
participating.
doctor, anyone who needs one Ayurved email or anything, they can email us at wellness@imt.care and we'll share all the form or social media links if you have missed them, which were shared in the chat box with you again. And for people who are in Mumbai, they also have 4 clinics in Mumbai in different locations, so they can also visit them.
Yes. Yes. Thanks a lot, everyone. Thank you.
thank you, thanks a lot.